Good morning, good afternoon, or good evening, depending upon the time of day you have chosen to view your health policies for Head Start. My name is Nurse Yolanda. Most people call me Nurse Yo, and I'd like to take the opportunity to welcome you to Head Start. You should have a training manual as I'm going through these slides, or you will have a copy of the slides as well that you can take notes on. So let us begin. So Head Start, and all of this is in a nutshell. As I just stated, you will have a binder or you will have handouts that you can review at your leisure. Please be sure to take the time to read each page so you have a clear understanding of what the performance standards states for Head Start. So what should Head Start Health Performance Services provide? Well, according to the performance standards 1302 subpart D, we must provide high quality health, oral health, mental health, and nutrition services that are developmentally, culturally, and linguistically appropriate and that will support each child's growth and school readiness. So, based off of that information alone, our policy states that every child enrolled in the consortium will receive high quality medical and developmental services, support through the implementation of a comprehensive approach of continuous care that will lead to successful child outcomes and preparation for Head Start readiness. So that means every child enrolled in our program, and I can't stress it enough, every child enrolled in our program will receive high quality services. Okay, so next slide. So how do we make this happen from a health standpoint? Well, according to the policies and procedures and the performance standards, all staff, including new staff, is trained or will be trained on CPR, first aid, and universal precautions. This will take place through several avenues. Either I lead, which is done on the computer, or the health team will train you on CPR, first aid, and or universal precautions. Again, this is done yearly and up for all new hires. Information is then entered into the Red Cross database. Certificates are downloaded, and then those certificates are sent to Human Resources to be placed in your files. Okay? The performance standards also says that you have to have training on prevention of sudden infant death syndrome, or SIDS as most people prefer to call it, with the exception of staff who do not have regular contact with children on a day-to-day basis. So if you're working in the early Head Start classrooms and you're working with these children on a day-to-day basis, then you are required to have training on sudden infant death syndrome or the prevention thereof. All facilities, no matter where our children are housed, all facilities where children are served, including the areas for play, learning, sleeping, toileting, and eating, must meet the licensing requirements if the school is licensed. And because we have so many schools that are licensed, those requirements apply for every school setting. So, in other words, when we come out and we do the AT families, education does the CATS, the health team does the HAT, which stands for Health and Safety Tools. We come into your classroom, we're checking to make sure that the equipment in your classroom is working properly. We're checking to make sure there's no broken pieces of furniture in the classroom. We're also checking to make sure that every outlet that the children has access to is covered with a safety cap. So every electrical outlet must be covered with a safety cap. Now, oftentimes when we're out doing our assessments and we come into your classroom, the first thing the teaching staff typically says is that the janitor or the custodian removed the safety cap when they were vacuuming the room last night, which is totally understandable. However, it is your responsibility that when you go into that classroom first thing in the morning, that you are checking to make sure that every electrical outlet has a safety cap on it. So also, we have to make sure that disinfectants, sanitizers, and soaps, they are labeled and up out of reach in a locked cabinet where children cannot access them, and that you have a keep out of reach of children sign posted on that cabinet. So in the event that you don't have cabinets in your classroom, those chemicals must be placed up out of reach of every child in that classroom. The tallest child in your classroom, if he or she is to stand on the chair, it has to be placed above that area, above that reach area of that child. So keep that in mind. All disinfectants, all sanitizers, and soaps must be labeled and up out of reach of children in a locked cabinet with a sign posted, keep out of reach of children. And remember, you want as minimal chemicals in your classroom as possible. You do not need brake fluid in your classroom. You do not need lime away in your classroom. The only chemicals that you need in your classrooms is the chemicals that the CFP coordinator, CACFP coordinator, and the registered dietitian, which is Mary Lou and Anna, when they go over and do their training, those are the only chemicals that you need to have in your classroom. All right, so keep them in mind. We want the minimal chemicals as possible in your classroom. Okay. Another thing to keep in mind is that you want to make sure that all of your posters are posted visibly, so when parents are picking up or dropping off, your posters can be seen. Your prohibition poster, where it states the use of tobacco, alcohol, illicit drugs is prohibited in this building or on these grounds. Those posters need to be visible for the parents. Also, all requirements for licensing is designed to prevent child injury, which includes choking, strangulations, and electrical hazards. Tripping over cords. Make sure those are out of the area for your children. Keep your room as safe as you can. Next slide, please. So, again, how do we make this happen? We have to make sure that we are equipped with safety supplies, including fully stocked first aid bags. There should be 2 first aid bags in each room. Typically, they're posted near your exit doors. Some classroom has 2 doors, some classrooms have 1 door. You can post one in the front of the classroom on the back door and you can post 1 first aid bag in the front of the classroom near the front door and 1 in the back of the class near the back door, okay? We also have to make sure that we have designated toilet and diapering areas for our children, which are separate from food preparation. So your changing table should not be placed in your kitchen. It should be 2 total separate areas. And you should have posters posted in your diapering or toileting area that says diapering. And then in your kitchen area, you will have your kitchen posters. And we'll talk more about those as we get further into the slides. Make sure all medication is labeled and stored in a lockbox and is locked and in a locked cabinet. And again, if you don't have a locked cabinet, it must be up out of reach of children. This includes all medications. Typically, we store them in red bags. Sometimes we even have blue bags. Whatever color medication bag you have for that particular child, make sure it is labeled and up out of reach of children and locked, okay? Make sure all staff have training on prevention and control of infectious diseases, which is your universal precaution. Those videos will follow when you have your ILEAD training and or your CPR training. Also, we have to make sure that all staff are trained on hygiene practices, which means washing hands for all individuals, including staff and children. And mainly, again, making sure that our environment is safe for our children. Next slides, please. So, we have to make sure that staff and students utilize good hygiene practices, which means they're washing their hands. So when should we be washing our hands? Before and after food preparation, after toileting or diapering, before and after eating meals or snacks, after coughing or sneezing, before and after giving medications, before and after first aid or universal precautions, which again, those posters are to be posted in your classroom and they are to be visible. Please, 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 please remember, when you are wiping the nose of the infant or the children, make sure you apply gloves, and then after you take off the gloves, after you can finish wiping the children's nose, that you wash your hands and you wash the children's hands as well. Okay? Please, please, please do not stick dirty napkins up your sleeve or put dirty Kleenexes inside of our first aid red bags. Okay? So again, how do we make sure all this happens? How do we accomplish all of this? Well, we do it according to our performance standards, which everything goes back to our performance standards. Everything that we ask you to do, everything that we implement in the classroom, it is based off of the performance standards. Nothing that we make up along the way, it is based off the performance standards. And our performance standard says we must provide high quality health, oral health, mental health, and nutrition services that are developmentally, culturally, and linguistically appropriate, and that will support each child's growth and school readiness for every student. Okay? Next slide, please. I'm going to skip this one because this is where we pause and we play our exercises. But because you're watching this video, you will not play that exercise on this video. Okay, so again, how do we accomplish all this? It takes teamwork. There's no way one department or one individual can accomplish all the needs necessary to make sure that we provide safe environments for our children if we do not work together. Teamwork makes the dream work every time. There are no big I's or little U's in teamwork. We are all in this together to provide a safe place, a learning environment for our children. So we need URSIA. We need the education department. We need our family and community engagement department. We need the health team. We need our transportation team, because if transportation is not here to pick up and drop off the kids, because every parent doesn't have a vehicle. We need our technology and information support team, which is the computer people. We need our fiscal people, which is the people who handle the finances. We need our community and self-assessment that tells us the needs of the community. We need our facilities workers who helps to keep our buildings safe. We need our training and professional days. We need communication with one another. We need record keeping and reporting. And most importantly, we need our parents and our children. We are all a team here, and that is the only way that we can be successful, is working together with one another, again, trying to accomplish safety and a learning environment for our children. Next slide, please. So, what is a team? A team is a group of individuals working together, trying to achieve a common goal. And our goal is providing high quality care or high quality services for our children, and to make sure that environment is safe. We are building on our strengths while minimizing our weaknesses. We are a team, and again, together, teamwork makes the dream work every time. Next slide, please. So, the health team is actually composed of two different teams. we have the nutritional side of the team, and then we have the medical side of the team. The nutritional side of the team, which is also for CACFP, and you'll learn more about that training with Anna and Mary Lou. Anna is the registered dietitian. As you see, her email address is posted and her phone number where she can be reached. And then Mary Lou is our CACFP coordinator or our CACFP specialist. Her email address along with her contact information as well. Anna is responsible for all food restrictions. So if you have a child who cannot have peanut butter or peanuts, that information would be sent to Anna's email address. If you have a child, let's say the same child who cannot have peanuts or peanut butter, they are allergic to peanuts or peanut butter, and they are required to have an EpiPen while at school, that information would be sent to Anna and myself. But if the child had no medication to accompany his or her allergy, that information is only sent to Anna. Anytime you have a feeding plan, feeding plans are for children that are 0 to 12 months of age. That information is sent strictly to Anna. Okay? Mary Lou gets all of the CACFP paperwork. That is her specialty. She specializes in that area, so that information goes to Mary Lou and Mary Lou alone. The medical team is composed of my co-partner, DNL. He is a certified medical assistant, but he is also a doctor in his country. His cell phone number, where he can be reached, along with his email address. I am yours truly, Yolanda Washington, the health manager. My email address, which is actually incorrect. Let me correct that right now. It is ywashington@headstartesj.com. Okay. My office phone number and my cell phone number. If your needs are urgent, I would suggest you text me or give me a call. Oftentimes, because I'm out in the field, I'm in some buildings where the reception is poor, and I may not receive a phone call, but I will receive your text message. But at any event, you can text me, or you can call me, or you can send me an email. But if your needs are urgent, I would advise you to text me. And then please allow me some time to return your phone call. Again, as I stated, I am the health manager here at Head Start. So not only am I coordinating the health requirements or the health documentations of over 1,000 students, I'm also dealing with parents and other staff members. So please give me a few minutes to return your phone call or return your text message. And then give me at least 24 to 48 hours to respond to your emails, okay? Whenever you are sending medical information, let's say the parent has given you a physical, make sure you send that information to DNL's email address, which is this email address right here. Same thing, I apologize, makes it a little less letters you have to type in. Send it to his email address as well as to my email address, the Y Washington at Head Start. And then you're also going to send it to our health email address, which is hshealth@headstartesj.com. Okay? Between DNL, myself, and Miss Rebecca, which this is her email address, we will retrieve that medical information and get it entered into Child Plus as soon as possible. Okay, so please be sure to send it to all 3 email addresses. As I previously stated, DNL and myself, we are out in the field and we're working, so we're not always sitting at our desk entering data, entering that medical information, but be sure to send it to all 3 email addresses. Okay? Forms. Again, I'm just going to reiterate what I just stated on the previous slide. All medical and health documentation goes to HS Health email address, D Jimenez email address, and @Washington email address. All food allergies or food restrictions or food-related restrictions, including infants or toddlers who have to have thicket in their drinks, and feeding plans goes directly to Anna. In the event the child has a food allergy and requires medication for that allergy, then that information would also be sent to Washington, D. Jimenez, and HS Health along with Anna. Okay? All food allergies with medication, please include all 3 of those email addresses plus Anna's email address. All CACFP paperwork goes to Mary Lou. Okay? All right, next slide, please. All right, so as we're talking about our teams, on day 1 or when you're getting your classroom together, please be sure to post your health and safety team assignment list. So you and your co-teacher get together and decide who's going to be responsible for what task in the event of an emergency. All right? So in this instance, we have Jane Harris and we have Joe Bluegrass. Miss Jane and Miss Joe will get together and decide who's going to call 911 in the event of the emergency, who's going to gather the kids, who's going to be responsible for counting, and so on and so forth. In the event Joe Bluegrass gets a new job and he's no longer employed at Head Start, your team assignment sheet needs to be changed as soon as possible. Also, you need to note at the bottom of the form the secondary site for emergency evacuation. So in the event there is a fire at your school, what would be the closest building that you would go to and take your children? And then your program manager needs to sign off on your team assignment sheet. This is to be posted near your exit doors. So if you have a front and a back door to your classroom, post one in the front and back of the classroom. If you only have a front door, then only post it near your front door classroom. Okay? Next slide, please. All right. So you'll hear us talk a lot about 30, 45, and 90-day requirements according to the performance standards. Okay? So some of the performance standards requires that we have health insurance cards on file and or Medicaid cards on file and birth certificates. That information goes directly to the URSIA department. It does not come to the health team. The URSIA department consists of Melanie Dolph or Cindy Culver. Okay? And I apologize that I do not have that information posted, but once you're entering the information on your computer, if you type in Cindy's name, her last name will pop up along with her email address. And if you type up Melanie's name in the search engine, her email address will also pop up in the search engines or on the computer. So please be sure to send that information to them. New this year is speech referrals. All speech referrals, new speech referrals goes to Christina Bromley. Again, type her name up on the computer on Outlook and Christina Bromley or CB, and her email address will pop up as well. However, the health team will enter those speech results, but new speech referrals do go to Christina Bromley. Okay, so every child enrolled in Head Start will have a health file or will have records. Every child has one, and that information is confidential. The information that you learn about your students at your site is only to be shared with the appropriate individuals. That information is not to be shared with your parents. That information is not to be shared with another teacher who works at a totally different site. That information is to remain confidential. Every health record or every file that a child has It contains a health history. That is information where you can go to find out if the child has had past surgeries or if the child has allergies. Most of the time, and that is if the parents decide to put that information on that form. They also list conditions and or problems on that health history. The nutritional status, food restriction, allergies is also in the file and is also listed on the health history. Physicals is in the child's files. All physicals are due within the first 30 days. Day 1 means the first day the child comes in and sit in that chair. That is when that physical is due. Most times, the parents have the physicals completed already, but just failed to submit that information to us. Work with your parents to get that information into us as soon as possible, okay? Also, immunizations. That is due before a child can even start school. Immunizations must be current and up to date in order for that child to even attend on day 1. Dental exams, they're due within the first 90 days. However, we work with parents to get those dental exams in as soon as possible, or at least within the first 30 days, okay? When does a child need to see a dentist? A child needs to see a dentist on the first time he or she has an eruption of a tooth. Sometimes that's 6 months of age. Sometimes that's 8 months of age. But no matter what, that child is encouraged, or that parent is encouraged to see the dentist at that time. After that, it is recommended that children see their dentist every 6 months. However, some dentists will indicate on the dental forms to return within a year. Okay, so we follow what the dentist says. Everything is documented in Child Plus. So that dental exam will be documented in Child Plus. If the child had cavities and needed to go back to get those cavities filled, that would be documented in Child Plus under follow-up treatment to make sure that that child received proper dental treatment. Okay? Labs are done on every child at the age of 12 and 24 months for a lead and hemoglobin. Okay? This is according to the EPSDT. Now, sometimes the physicians omit to do a lead and or hemoglobin for whatever reason. Sometimes they forget about it. Sometimes the parents refuse to. But at the end of the day, because it is a requirement, we have to follow those requirements. So we either send the child back to his or her physician to have it done, or the health department, which we partner with, they will come in and do lead screenings. But the child will be required to still have a hemoglobin. We can do hemoglobins on site. They are non-invasive. We take like a piece of tape and wrap it around the child's finger, and that actually reads the hemoglobin or the iron level of that particular child. But again, the first line of defense is to have these labs done by their primary care physician. We also do hearing screenings, hearing and vision and blood pressure. Again, if it is not completed by their primary care physicians, we also have community resources who come in. We work with the family and community specialists and the health team, but together we accomplish in getting these, together we get these screenings completed. Hearing and screenings also can be completed on site, okay? Disabilities, IEPs and IFSPs, again, that goes to the URSIA department. It goes to Melanie. Again, you can just type her name in the search engine on Outlook, and her email address will come up, and that information goes to her. And then they also do Denver and DECA screenings. Next slide, please. So, if you're doing an application with a parent and you are completing, and they are doing the health history form, remember to ask open-ended questions to allow parents to list any disorders or problems that they can think of, such as diabetes or asthma, meningitis, anemia. Maybe the child had a high lead level at one point in time. But anything, if they wear glasses or hearing aids, we're encouraging them to share with us as much information as possible so that we can know as much as we can about the child, which all encompasses of our performance standards of providing those high quality services to every child. Okay? Remember, those health workers are confidential and should only be shared with the appropriate individuals. And then also sometimes when children come to school, parents don't always have a physical completed at that time, and they have those 30 days to get that physical completed and into us, or at least pending appointment, and we do need that documentation so that we can place in the files. Again, this is a requirement, it's nothing that we're making up. In the event that licensing comes in and pulls that individual file, we will have documentation that the child does have a pending appointment, and it's also documented in Child Plus that you had a conversation with the parent about the need for the physical. But in the event the physical comes back, and let's say the child has asthma, and the doctor indicated that the child has asthma and the child requires medication at school, at that time you will inform the health team that you received a physical from the parent, and that child is now in need of a health care plan, and the health team will act appropriately to get the necessary documents to move forward on that child's health care plan. And we'll talk a little bit more about health care plans in the upcoming slides. All right, so again, health history, again, is just the history of the child. There is diagnosis and treatments that the child has had previously or they currently are dealing with. We want to know, how long ago did this happen? If the child is being still treated, or how long did the treatment last? Remember, parents or guardians, sometimes they are reluctant to share information. Why? Because they're fearful that the child will not be accepted into Head Start, or they don't want to do all the extra paperwork, especially if it's a returning student. And then sometimes they think that we're trying to be nosy. But please make sure you share with them we're not trying to be nosy. We just want to know as much information as we can about the child to provide a safe environment. Okay? Next slide, please. Nutritional needs. Again, anytime the child has any nutritional needs, you will work closely with our registered dietitian. Again, that's Anna. And only include the health team if medication is involved. All right. So again, immunizations, they must be up to date. They must be current on their immunizations in order for them to attend day one. If the child is not up to date, that child is considered incomplete and cannot start at that time until the child is caught up to date. And we work with the parents to get the child caught up to date as quickly as possible. Physicals, again, are due within those first 30 days. Early Head Start, unfortunately, those infants require a well child exam at least every 2 months or every 3 months. So they require one at 2 months, 4 months, 6 months, then at 9 months, 12, 15, 18, and then 24 months. Then after that, they are required yearly. Remember, we are teaching our parents to develop a habit of getting comprehensive health services for the child. And so that's why we have to remind them, okay, it's time for your child's 2-month well child exam. Okay, now it's time for your child's 4-month well child exam, okay? The health team will be working with the program managers and family and community specialists to notify parents when those 30 days are approaching or when they are expiring. Okay, so if let's say you received a physical back in the beginning of the school year and it expires in February, and here we are in January of that year, then we will be working with those parents to remind them that your child is due for his or her physical next month so that they can call the doctor's office and get an appointment. Next slide, please. Key points to remember: nothing we do for the child will have any lasting significance if the parent or guardian does not take responsibility for the ongoing health care of their child. Again, we are working with our parents because our parents are part of the team. We are a team, and teamwork makes the dream work every time. Get your parents involved as much as possible. Okay? We talked about the dental services. We talked about the dental exams. We also talked about the dental treatment and or follow-up. So work with those parents to get those children back into the dentist if they have cavities and or need dental work done. Remember, we're documenting everything in Child Plus. Everything goes documented in Child Plus. Okay? And in the event that the parent doesn't have, let's say, financial means to get the child, let's say, asthma medication, then we would work with those parents to get that medication for that child. But we have to make sure that we explore all avenues possible: their insurance, Medicaid, and other resources. And if for some reason that parent cannot get that child's medication, please make sure you let your program manager know, as well as your supervisor, and we will work together to get the medication that that child needs. Okay? Next slide, please. All right, so we talked about our leads and hemoglobins. Again, the first line of defense is to have those screenings done in their doctor's office. But in the event that it's not done, we're going to work with our community resources, we're going to work with our family and community specialists, and we're going to work with the health team to obtain that information. And the same with the blood pressure. Blood pressure is part of the 90-day requirement, as well as the dental treatment and or follow-up for the hearing and screening, okay? Hearing and vision screening. All right, so that's 30, 45, and 90 days. Our goal is to get all those screenings done as soon as possible. All right. And day one starts when the child attends school and sits in that seat. If a child has a disability, please ask the parents if the child has an IEP, so that, again, we can provide the necessary services for that child. Okay? Anytime that the child fails one of his screenings, let's say the child fails his hearing screening, okay? That will be noted in Child Plus as an identified need, which means we need an action, which means within the next 30 days, we are going to be rescreening that child for that vision exam so that we can notate that in Child Plus, and we will create an action based off of that identified need. All right? Health team, community resources, and our family and community specialists, we will work together again to do these screenings and rescreenings. Anytime that we will be in your buildings for vision, hearing, leads, or hemoglobins, please, 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 please inform your program manager, and also make sure that your building principal is aware that we will be in the building conducting those screenings. Again, communication, communication, communication. It is so important that we communicate with one another, okay? And again, our goal is to get these screenings done within the first 90 days that the child attends, all right? Family and community specialist, it is your responsibility to rescreen the children or to obtain missing children as they are enrolled throughout the school year, okay? Because we have parents who move, or parents who decide to pull their child for whatever reason. We are always enrolling children all year round, okay? So make sure that that child, when he or she is enrolled, they attend on day one, their count starts then to get those screenings completed within the first 90 days. Document, 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 document. I can't express that enough. Documentation is key, all right? Make sure we're documenting it in Child Plus. There's also a form called authorization form when we're doing those screenings for the blood pressure, the lead, the hemoglobin, that we're documenting it on that form as well, Okay? And again, all communication will be documented in Child Plus. Also new this year in Child Plus, as you're entering data, if by chance you are entering the data, this may or may not be part of your role as a new employee, depending upon the position you are hired for. But if you are entering data and you are the individual who's making phone calls to these parents regarding leads, hemoglobins, hearing, or screenings, there is a little box in Child Plus up under the screening that is being completed that you would click on that says parent notified. You would type in the parent's name. On the next line, you would type in your name on the next line, because it says contacted by who. You would write your name on that line, and then it asks for the date and time. So remember, all this information is documented in Child Plus. And again, depending upon the role that you are in, it may or may not be your responsibility, but you will get more training depending upon the position that you are in. All right, so let's talk about some forms. Next slide, please. So we talked a little bit about the well child exams and or physical requirements. Again, if you are in early Head Start, it is required that you have a well child form 2, 4, 6, 8, 9, 12, 15, 18, and 24 months of age. Now, there are some physician offices who do not do 18-month well child exams. In the event that you should have a child whose physician does not do 18-month well child exams, please get a documentation or statement from that office stating that they do not do 18-month well child exams, and make sure the health team gets a copy, and a copy is placed in the child's file. Okay? Simple as that. Next slide, please. This is a completed well child exam. As you are looking at your screen, the physical to the left, it is partially acceptable. And I say that because it is acceptable because it has the child's name, the date of birth, the height, the weight, the head circumference, the blood pressure, the hemoglobin, whether or not they're at risk for TB, and their lead, and then of course the physical assessment and the health conditions. Also, the doctor listed on here the medication that the child needs for his or her asthma. The only thing that is missing on this particular physical is the doctor's signature. We must have the doctor's signature on all physicals, or that physical is invalid. So in the event that a parent should hand you a physical, it must have the doctor's signature on that physical. It does not necessarily have to be our form. It can be the doctor's form or the form from the office. As long as the doctor's signature is on it, that is fine. As long as it is stamped with the doctor's signature on it, that is fine. As long as the physical summary states electronically signed by Dr. Blue, it is acceptable, okay? And then we also need the date of the exam, okay? This is new on the forms this year. We need the date of the exam as well. And so remind your parents to get this entire form filled out in its entirety, including hearing and or vision screenings, okay? The form to your right is not acceptable. Why? Because we can't read it, okay? So this form would not be acceptable because we can't read anything off of this particular form. So be mindful as parents are handing you these physical forms. Okay, next slide, please. Okay, so let's say that we have a student who's enrolled on day one and they attend school. Their immunizations are up to date, but they don't have a physical. So they've gone to the the doctor's office, and they got an appointment card, or they went to the dentist's office and they got a dental card, and they brought it to school and they handed it to you and you sent it to the health team. All that is good and dandy, but the problem is There's only a first name on this appointment form. It says someone by the name of Oliver. We have no idea who Oliver is, because if we was just to type Oliver up in our database, every Oliver that was ever enrolled in Head Start would pop up. So we need first name, last name, and date of birth, okay? And then that information is entered into Child Plus, and this form is placed in the child's file. Next slide, please. Okay, the form to your left, it is a dental form. When parents give you forms like this is not acceptable. Why? Because there's no doctor's signature right here. We have a first name, last name, date of birth, date of an exam, everything that took place in the exam, and that there was no decay. Yay, Billy. But guess what? There's no signature. Okay? The form to your right. This is excellent, right? We got the date of the exam. We have the first name and last name. We have the phone number. We have the date of birth. We have the exam, what was applied to the child, what took place for the date of exam, that the child doesn't have any cavities. Yay! The doctor's signature, although it was signed by a medical assistant. And how do I know that? Because the medical assistant put her initials and she signed it, which makes this not valid. Why? You guessed it. Because it's not the signature of the doctor or the dentist who performed the exam. It must be his or her exam. If the medical assistant had not put the initials and circled it, then that would have been acceptable because that would be the doctor's signature. But this tells me that the medical assistant signed for the dentist and then she initialed it, stating that she signed for it. So it's not acceptable. But you get the gist of it. We need a complete physical form filled out by physical form or dental form filled out by the physician, and it must be legible. Next slide, please. All right, so let's talk about our prenatal and postpartum. So as you know, or you may not know, we also service pregnant moms. All right, so pregnant moms are enrolled into our program during their pregnancy, and then 2 months after they deliver, we are meeting with these parents and moms, these new moms, and we are doing postpartum assessments. This is the postpartum assessment form that we need on our new moms. It needs to be filled out in its entirety by the doctor, okay? Which includes the child, the mother's name, the new mom's name, date of birth, and so on and so forth. The same requirements that we require for our infants and our toddlers is the same requirements we require for our parenting moms. They need a physical on hand and they need a dental exam within the first 90 days as well. Okay, so again, work with these new moms or these parenting pregnant moms and work with their moms as well, because sometimes they're underage. They may be 13 years of age, they may be 14 years of age, but regardless of their age, work with those parents, work with those families. Okay, again, this is part of our federal requirements. This is what is required. This is what is required by us through the federal government, and because we are a federally funded program, we have to do what they say. Okay, so next slide, please. Thank you. All right, this is also part of our pregnant moms, our prenatal and our postnatal forms. Upon enrollment, our pregnant moms are filling out the prenatal exam. It wants to know their due date. It wants to know if they're seeing a physician. It wants to know if they are on WIC, and so on and so forth. Okay, so this information is filled out during the pregnancy. That is this form right here to your left, and then the form to your right. That is filled out after they give birth. However, we can start it during their pregnancy. We can fill out their name, their date, their address. We can fill out their due date on this form as well. And then we can also fill out the name of the physician or the clinic that they're attending. Okay, So this information is also due for all our pregnant moms. Next slide, please. All right, let's continue talking about our pregnant moms and our childbirth record. So this is a childbirth record. This record is required on all children 0 to 3 years of age. If they are a returning student, we should have one on file. In the event that we do not, please obtain this information and submit it to the health team so that we can get it entered into Child Plus. If we have a breastfeeding baby, let's say we have a pregnant mom, she delivered her baby and now she's breastfeeding. Mom is attending school at one of our sites as well as with the baby. We need mom to fill out this breastfeeding form. You can obtain these forms from Anna, the registered dietitian, but mom needs to fill out one of these forms so that we can place it in the baby's file. And of course, Anna will talk more about this when you have her training. The last form on this slide is the feeding plan. This is from 0 to 12 months of age. This form goes to Anna, the registered dietitian. Mom gets it filled out. Mom fills out the top portion. Doctor signs her date, or the doctor may even attach a form to this. It is mom's responsibility to update this form as the child grows. So let's say we got a 1-month-old who's now only taking 2 ounces every 4 to 6 hours. Time goes by. Now baby is 9 months of age and baby is eating baby food, and the baby is taking let's say 4 ounces of a formula after her baby food. Mom's responsibility is to indicate that on this form. Okay? Anytime there's a dietary change, mom needs to indicate it on this form. All right, next slide. All right, so I talked about our postpartum moms once they give birth, and we're doing that 2-week assessment on them, the postpartum assessment after they deliver. This is part of those forms. This is all the information that we obtain regarding baby and mom, okay? And then mom signs and date. If the father of the baby is present when we're doing this assessment, we also do the education for the father of the baby as well, and we have him sign on this form as well. Again, this may or may not be your responsibility depending upon the role or the position that you were hired for. Okay, next slide. Oh, and if I go back to the other slide, please. Also, again, I am working, the health team, we are working with the pregnant mom as well to obtain this information. So we're working with that family and community specialist of that pregnant mom, and she's working with me, and we're working together to get all the necessary information for mom and meet with mom after baby is born. All right, okay, thank you. Next slide, please. All right, so now we're talking about a right to refuse services. Do parents have the right to refuse services? You bet your bottom dollar. So in the event that the parent refuses to have, let's say, a hearing screening done, which is perfectly fine. They can take their child to their primary physician and get that done. Please, please have mom sign this form. It is called a right to refuse services. Mom has to sign this form, and you write on here if it's a hearing screening or vision screening. You send this information to the health team, to all 3 email addresses, and the original goes in the file. All right, let's talk about immunizations. Let's say mom, they're totally against giving immunizations to their kids, which is perfectly acceptable. Mom has to fill out this refusal to vaccinate her child form. It is called a parental declaration of child vaccinations. Okay, so in other words, she is declining to have her child immunized. Excuse me, I apologize. I muffled that up with my wording. It is a parental declination of child vaccination form. So in other words, mom is declining vaccines for her child. Mom or guardian, whoever is in charge of this child, must fill this form out every year. And it is to be accompanied by a note from the doctor's office and the doctor can also include it on the child's physical. Okay, so mom signs this form, then she follows up when she turns in that physical. It's noted on the physical, or she has another piece of documentation that states that she does not get her child immunized. Okay, all right. If you have any questions, again, just always reach out to me. Next slide, please. All right, so let's talk about these fabulous healthcare plans. All right, so at enrollment, certain conversations should trigger a red flag. If mom states, my child breaks out with a rash if he or she eats peanuts, and I give her this medication to help with that, or I give her a shot, that's a red flag. All right, this is the time we come in with our open-ended questions. Tell me more, Mom. What do you mean? Your child breaks out with a rash. What does that look like? How often has it happened? When was the last time it happened? What medication was it that you gave the child? Okay, you want to start digging deep. Okay, that is information that you will definitely share with the teaching staff that's responsible for this child, as well as with the health team. Okay? All health care plans are directed by the primary care physician or the nurse practitioner. Okay? We do not, and when I say we, I'm talking about the health team and I'm talking about teaching staff. We do not override doctor's orders. Okay? What the doctor writes, that's what he writes. The only thing I'm responsible for doing is making sure that the dosage lines up with the standards for the child's weight. Okay, and in the event I have a question about that, then I will reach out directly to that doctor. All right, so again, all of this is part of our performance standards. Within 30 days to make sure families have a primary medical doctor and a dental doctor so that they can get this healthcare plan started. So when we're doing a healthcare plan, we need 3 forms, okay? 3 forms need to be completed for an individual health care plan. That's what IHCP stands for. Next slide, please. All right, so the form to your left, where you see the arrow going around, that is the health care plan itself. Mom can fill out the top portion, which is basically the demographics, name of the child, the diagnosis, the date of birth, the date, so on and so forth. It's self-explanatory. Section A is asking for medications at homes. Mom can list the medication that the child takes at home in this top area. B, this area right here, is to be left alone. This information will be filled out by the health team and the health team only. Okay? Mom can answer these questions in the box. Mom can also let us know what signs and symptoms to watch out for in the event that the child should need his or her medication. So again, let's go back to the fabulous asthma, all right? It wants to know when was the child diagnosed, okay? It wants to know who's the primary care physician, any emergency visits, any overnight stays, anytime, has the child had to miss school from previous school. This information can be filled out by mom. This information again, what signs and symptoms are we looking for that would indicate the child needs his or her medication? Wheezing, coughing, struggling to breathe, whatever it is, mom can underline it or mom can circle it. And I'm saying mom because 80% of our families, when they're enrolled, mom pretty much takes care of the paperwork. However, it can be dad if dad is the primary caregiver. It can be an aunt or uncle if they have primary care of that child. So the primary caregiver of that child will complete this information right here. Then they will date it. They will sign it. The teaching staff will sign it. The family and community specialist that's working with this family will sign it. If the child is catching a bus, that bus driver will sign it. And then, most important, you need the signature of the health team, myself, Yolanda and or Dionelle. If our signature is not here, it is not valid, and you do not have a right to give any information because it has not been verified by the health team. So make sure you have the health team signature here, the mother's signature, and then the other staff member signature. Okay? Our form to the right, that is permission to administer medication. That form the top portion is completed by the mom. Okay? Again, it's asking name of the child, date of birth, the reason for medication, name of the medication, the name of the doctor, the phone number of the doctor, the signature of the parent, and the date. Can be filled out by the parent. Anything below this box is to be completed by the physician. Okay? This form, mom takes to the doctor, and doctor fills it out, signs it, and she brings it back. Now, let's say doctor didn't use this form to write down that the child is to have albuterol inhaler, 2 puffs every 4 to 6 hours as needed for wheezing. Maybe he just typed up a letter from the office and signed it and sent it to mom. That is perfectly acceptable. Mom still needs to fill out this top portion, and we will attach a copy of that documentation to this form. So it is okay if doctor does not utilize this form. Okay? And then we have the good old medication administration record. Okay, so now Johnny needs his medication. He's been running around outside on the playground, and now he's coughing excessively, and he needs his albuterol inhaler. You are going to find the month. You're going to go to the date. You're going to initial and time right here. You are going to come down to the bottom. You're going to put your initials. You're going to put your signature. You're going to make a little small note, not a book. Johnny was coughing, gave inhaler, no coughing afterwards. And you're going to sign, period. That's it. That's all you need. You're not going to write a whole book, something simple, sweet, and to the point, okay? In the event you need more room, you can flip over this piece of paper and write on the back. This top portion is to be filled out by the health team and the health team only. We are responsible for getting this document to you. So in the event you have a health care plan, and I'm going back, you have a health care plan, you have the permission to administer medication, you go to administer the medication and you don't have the medication administration record, let us know as soon as possible so that we can get that to you immediately. Okay? Also check Child Plus because our goal is to get all these documents scanned into Child Plus up under the health section. So of course, at the beginning of the school year, it's kind of hard to get every document scanned in the system before you need it. So in the event we hadn't got to that child, please feel free to reach out to us. Okay? Next slide, please. All right, again, we talked about the missing signatures. Work with parents to get these healthcare plans done as soon as possible, because then, if not, the child can attend if it's for medication such as for asthma or seizures or severe allergic reactions, because we have to make sure we have the proper documentation and the medication on site. But in the event, work with these parents to get this documentation done as soon as possible, because otherwise it leads to chronic absenteeism, which leads to another whole problem. Okay, so work with your parents, get that paperwork submitted to us so we can get it into the system. And then always make a note in Child Plus under the health section, under individual health care plan, and you make a note, had a conversation with mom, met with mom, talked with mom, whatever the conversation is or whatever took place. Okay, again, you'll get more information you'll get more one-on-one training when you're entering stuff into Child Plus. All righty, next slide, please. It is everybody's responsibility to make sure that all medication has a label on it for the child, or we cannot use it. Okay? So, what is a label? A label is the child's name, the date that the medication was picked up. It's the name of the medication, how often to give it, the instructions on the medication. Sometimes they will even note the side effects. It may cause drowsiness. It may cause hyperactivity. The pharmacy number is on there. The name of the pharmacy is on there. The person that filled the prescription. Okay. Always send us a copy of that if we're not on site with you as you're doing a healthcare plan with a parent. Again, depending upon the role that you're in, the responsibility, the role that you was hired for. It may or may not be your responsibility, but if you are one of the ones who are working with parents to get healthcare plans, please, you can always send us a picture of this information, and you can also send us a picture of the documentation. We will fill that information out for you as soon as possible and get it back into your hands. Okay, but again, make sure you are checking to make sure that the label is intact and that there is an expiration date. Now, just the other day, we had this incident happen. This is the first time that I can recall. The parent went to pick up the medication from the pharmacy. The pharmacy put the medication in a bag unopened. It was an inhaler. And instead of putting the label on the medication, the pharmacist stapled the bag with the inhaler inside of the bag, inside of the box, and placed the label outside of the box on the bag. And it was stapled. So when the parents brought it to us, we had to open it and verify it. And we will have instances that just happen out of the blue. Please check with us before you accept any medication that is not labeled. In that instance, we did verify everything, and everything was correct, everything was legit, and we are the ones who actually opened up everything. So in the event that something out of the norm happens, reach out to us, let us know so we can work with you and the parents. Okay? If the medication is to be taken to and from school, we will create a red bag for that child. That red bag, there's a label on the outside of the red bag with the child's name, the school, whether or not the child catches the bus number, and the name of the medication and the reason for the medication. Also, all staff members, teachers and or FACS, family and community specialists, please make sure there is a picture stapled to that ID label of the child that's on that red bag. So there's an ID label and it's asked for a photo of the child. Please place that there. In the event that the teacher is out, ill, there's a substitute, and she may not know who that student is. So we're using photos to help identify the child to make sure that you're giving the right medication to the right child at the right time, which is part of the child's rights when receiving medication. And we'll get to that as we get further into the slides. Okay. So for our healthcare plans, due to the pandemic, there was a hold or pause on utilizing nebulizers in the classroom in the event of the child may have had COVID. So they put a pause on that. That has now been reinstated. We can use nebulizers again. The child has to be separated into a separate place when you're using a nebulizer. The goal is just to use nebulizer on an as-needed basis for children that are 0 to 2 years of age. Okay. Once they hit that 2-year mark, they're encouraged to be instructed on the use of an inhaler, and for 2 to 3 years of age, 4 or 5, whatever, they are encouraged to use inhalers. But those little kiddos, 0 to 2 years of age, they can use a nebulizer. And again, they will be separated, go to a separate place, and utilize the nebulizer machine as needed. Okay. Again, you're going in a separate area. Remember, you're doing active supervision at all times with these kids. So even if you're giving medication, you need to make sure that you are actively supervising every child at all times. Okay, next slide, please. This is a child's ID band label. This is what goes on the outside of the red bag. This is where the picture goes, the site, the name of the child, the site, the room number, bus number, the reason for the medication, and the name of the medication. Okay? Next slide, please. This is the rights that I just got to talking about. Every child has a right to getting his or her medication. not only do they have a right to get his or her medication, but we have got to make sure that we have the right child, right dose, right time, right amount, and right reason, okay? Just because a hyperactive child who's running around the room that doesn't want to sit down at all times, just because he or she has Benadryl that has been prescribed for bee stings, do not give Benadryl to calm Johnny down in the classroom because he won't sit down, okay? Make sure you're giving that medication for the right reason, okay? So you're going to pull Johnny to a safe place. It's going to be a quiet place where you can concentrate. You're going to know Johnny's name. You're going to look at the medication administration record. It says Johnny. You're going to look at the permission to administer medication. It says Johnny. You're going to look at the medication administration record. It says Johnny. Okay, so Johnny, Johnny, Johnny. It tells how much to give, what to give, the amount to give, and the times to give. And then after you're going to give that, you are going to initial on the medication administration record, the date and the time that you gave the medication. Again, even before you do this, you're going to make sure that you're washing your hands and Johnny's hands, and afterwards, you'll do the same thing. Okay? So again, if you have questions, you can always reach out to us. All right, let's talk about the short-term exclusion. Yes, there is times when a child will be excluded from school. Okay, pause. Delete that short-term stuff. We're taking a break right here, and then we're going to go to the next section. All right, so we just ended the first section on health policies and procedures. Now we are going to move to our next session called communicable disease. Let's get started. All right, so short-term exclusion and admittance. There are times when a child has to be excluded from school, and it's not because of behavior, okay? It is because he or she may have a communicable disease that is easily transferable to another child and or staff member, that child has to remain home, okay? So I want to reiterate that sometimes parents will diagnose their children as having this, that, or the other. Before we diagnose a child, let me rephrase that. We cannot diagnose a child. The diagnosis comes from the physician. We just follow the recommendations of that physician for that assigned child. So when a child is diagnosed with a communicable infection, the child will be temporarily excluded from class and may return after treatment has been completed and documentation has been received from the doctor's office. Okay? Do not send the return to school note to the health team, but instead place it in the child's files so it can be part of his records. Okay? There are some communicable diseases or viruses that does not require a note to return to school, such as pink eye. Pink eye, they do not need a note to return to school. Now, unless they keep the child off for 2 or 3 weeks, that's something totally different. But typically with your pink eye, the child can be out for 24 hours. Typically they're prescribed eye drops, and then they can return 24 hours after the use of those eye drops. Okay? Same thing with like bronchitis. Oftentimes the doctors may keep them home for start them on an antibiotic, but 24 hours after use they can return. Policy for health attendants. Any ailment or any illness that goes past 2 days, the child will need a note to return. So for example, and listen to me clearly, for example, the child is out on Monday and Tuesday and does not return on Wednesday, but comes back Thursday, that child will need a note to return for because of that illness. If the child is out Monday and Tuesday, but returns on Wednesday, that child will not require a note to return. That child has 2 days, and he returned on the third day. Now, let me throw a scenario at you. Let's say the child was out on Friday. We do not count Saturday and Sunday as an absent because nobody works on Saturday or Sunday. Or let me rephrase that. The school is not open on Saturday or Sunday, and the child is not required to be in attendance. So if the child is out on if the child is out on Friday, he's out on Saturday and Sunday because we're closed. He's out on Monday, but he returns on Tuesday. He does not need a note to return to school because that's 2 days. But if the child was out Friday, Monday, and Tuesday and returned on Wednesday, then that child would require a note to return. If the child was out on Monday because he was sick, but he came back on Tuesday, and he was out on Wednesday, and returned on Thursday, he does not need a note because those are individual absenteeism because he came one day, off the next, came another day, home the next. Okay? These are consecutive days. So in reality, if you count up the days, it's 3 total days that the child is absent. He or she will require a note to return. So if the child, let's say the child comes to school Monday, Tuesday, out Wednesday, Thursday, come back on Friday, the child does not need a note to return to school. If the child is out Wednesday, Thursday, Friday, comes back the following Monday, he will need a note to return. So please, please, please communicate this information with your parents. As you're calling to find out why the child is out, make sure they know that the child will need a note to return if it's past those 3 days. Okay, so it's 2 complete days. If they come back on the third day, they're good. But if they're out that third day, they'll need a note to return. Okay, so work with the parents. Okay. If the child is out because he or she has surgery, we do need a note for the child to return because we need to know if there's any restrictions for this child to return. Okay? Next slide, please. If a child is found to have a communicable disease while in the classroom, the teacher will fill out an incident report. Let's say the child has a fever, okay? And they're sending the child home. The teacher will fill out that incident report. The teacher will notify myself, the health manager, that they have a child who has a fever of, let's say, 101.3 and is vomiting. They're going to call me with that information. I am going to give them permission to send that child home. Then that staff member is also going to let their program manager know that they have a sick child in their classroom, that the child has a fever of 101 and the child is vomiting, and they have permission from Nurse Yolanda or the health team to send that child home. In the event that I am not reachable, I'm at a training, or I don't hear my phone go off or whatever, then you are going to contact your program manager and you're going to say, I have a sick child. His fever is 101 and he's vomiting. And he or she will give you guidance. Okay? At the end of the day, you have to have permission to send these children home. Okay? Also, please, please, please send me, Nurse Yo, an email that you had Johnny Blue, who was in the classroom, who had a fever of 102.2, and he's vomiting, and we're sending him home. Why? Because we have to keep track of who we're sending home. Why? Because it's part of the attendance policy. Why? Because it's part of the performance standards. Why? Because the federal government keeps track of that information, okay? So please, please, please send me an email. I'll make documentation of Child Plus, why the child went home. Now, let's say you are in a building that Head Start is utilizing in a different school corporation. And you have a child in there who has lice, right? So we do not have a no lice policy, but our policy simply states that if a child has lice, he or she will go home, preferably at the end of the day, but you call the parents and let them decide. Let them know that the child has lice. Parent wants to come pick up the child at that moment, no problem. Parents can't find a ride and they're working on a ride, okay, no problem. Okay, you're going to monitor the child as you would any other child. All right. Mom picks up that child. She takes him home. She treats him. She cleans his head out. He can return the next day if she works that fast. Okay, but the child's head will have to be checked when he or she returns. All right, we do have teaching staff in us off-sites who have agreed to check the kids' heads, and we also have nurses in those off-sites who will check the child's head to make sure it is lice before sending them home, and also to check the child back in. Now, some again off-sites, as I was previously getting ready to state, they have a no lice and a no nit policy, which means if the child has lice in their building, they have to go home immediately, and they cannot come back until they are checked in by that nurse. Okay, so that's their policy. And guess what? We have to follow their rules. Why? Because it's their building. We are guests in their building, and we have to follow their rules. Okay? Next slide, please. So, when is a child too sick to attend school? All right, I'm so glad you asked. If the child has a runny nose, he's coughing, he has a low-grade fever, 100.1, no, let's say 99.1, that child should stay home, okay? If the child is having diarrhea, that child should stay home. If the child is vomiting, that child should stay home, okay? Let's say child comes to school and suddenly the child is laying around the classroom. He does not want to participate, and he's having diarrhea out of his clothes or his diaper. Guess what? You're going to pick up that phone and you're going to notify me what's going on, and we're going to send that baby home, okay? Anytime a child has diarrhea and or vomiting or a fever, they have to be at home for 24 hours minimum, diarrhea free and without medication for the problem, okay? So let's say you got a child that has a fever of 101 and they are crying and they don't want to participate. And you call me and I say, let's call mom. We're going to send this child home because the child has a fever of 101.4. The child can't come back the next day, but he can come back the following day if he or she is fever-free without the use of medication for 24 hours. All right? That is the policy, right? However, mom comes pick up the child, and the fever is 101.1. Mom takes the child right to urgent care. Urgent care says the child has an ear infection, and mom wants to send the child back to school the next day. She can, because we have a root cause of the fever. Okay? So she can come back in that instance. All right, and then you can just read through this documentation to see what else. All right, so what is diarrhea? This is diarrhea. None of the rest of this is diarrhea. All right, so again, make sure when you call me and you're saying that the child has diarrhea, make sure it looks like this and it is running out of the diaper or the child's clothes. Okay, that is diarrhea. And then verify it with your program manager, please. Okay, now let's throw this scenario out. We have a child who has had 3 diarrhea stools, but it has not come out of his diaper, but he's barely making it to the toilet, right? And he looks like he doesn't feel good. You're going to pick up that phone, you're going to call me, and you're going to give me an assessment, and more than likely, we're probably going to send that child home. First thing I'm going to ask, though, does this child have a fever associated with this diarrhea, okay? So make sure you're taking these child's temperatures, all right? Also, another thing, if you call me, let's say, first thing on a Monday morning, all Johnny do is wants to sleep. He doesn't want to participate. Does he have fever? Nope. Diarrhea? Nope. Vomiting? Nope. I'm going to say, let's give Johnny some breakfast to see how he responds to breakfast. Why? Because we're just coming off a weekend, and we don't know what type of weekend Johnny had. We don't know if he was up all night. We don't know if he had to stay at grandma's house all weekend. We don't even know if this child had any food. When the last time this child had any food. So we're going to feed this baby. And that's going to be my response for any child who comes to school that's not running a fever, that is mobile, and that's not having vomiting or diarrhea. I'm going to say, let's give this child something to eat. Why? Because I don't know when this child's last meal was. And I want to make sure that we offer this child something to eat before we send that child home. And I don't know if there's any food in the house, all right? So our goal is to keep our kids in the classroom. And, of course, we want them to be healthy, and we want them to be safe. We want them to be healthy. And in an event that they're sick, we will send them home. But I know that here at Head Start, it's a safe place. I know here at Head Start, the gas is on, the electric on, the water is on. There's, we have those exceptions where the heater may go out or the air may go out. But, typically we have somebody on site to get that problem fixed. But I know that the child is in a safe place. And I also know that we have food and we're going to feed this child. So that's our goal, to provide a safe and a learning environment for these children. Okay. Next slide, please. So we talked about this, making sure that you notify me and your program manager of all ill and sick children before sending them home. Please do not just send a child home without notifying us, okay? All right. Another thing we want to make sure that we're doing, please, 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 make sure you're doing your daily assessments, okay? Especially for your early Head Start staff members. When these parents, grandparents, aunties, uncles, caregivers are dropping these kids off, please make sure you're doing a visible assessment as much as possible. You're looking for unusual bruising, looking to see if the child looks like he or she feels okay. If the child just doesn't look like they feel okay, it's okay to say, hold on, Grandma, let's take Johnny's temperature before you leave. Why? Because if Johnny has a fever, we're going to send Johnny right back home with Grandma. But you're also going to notify myself, the health team, and you're going to notify your program manager, okay? But while we have a caregiver there, we're going to take that child's temperature, and if the child has a temperature, the child will go back home, okay? Again, 9 times out of 10, when parents drop off sick kids and they know that the child is sick, you're going to have a hard time getting in touch with those parents. Okay, so do the best you can to get those assessments done while the caregiver is there, and looking again for unusual bruisings. And this is a time to have a conversation. How was Johnny night last night? How was Johnny morning this morning? Okay, so you want to ask those questions. And again, you're doing those skin assessments right then and there. Now, for Head Start staff, it's a little bit tougher to do those daily assessments before the parents drive off or after and because of some of those kids catch the bus. So you have to do the best you can, but as soon as that child is released into your hands, you want to make sure that you're doing assessment right then and there, okay? And the reason being is because here's a situation right here. Look at these bruises on this child right here. Okay, and there was some on her shoulders, and she had on a tank top. And so the situation was, the bus driver went to pick the child up from the mom. The mom took the child to the bus driver, and the bus driver accepted the child, strapped in the child, brought the child to school. School driver gave the child to the teacher. Teacher signed for the child. Bruises there. Everybody noticed them. No big deal. Teacher takes, at the end of the day, teacher takes baby back to the bus driver, gives the baby back to the bus driver, and she's a child anyway. She's like 3 or 4. Bus driver takes the child back home, releases the child to the parent, and mom is irate. and when she sees these bruises. What in the world happened to my child? Where did all these bruises come from? And immediately, what does mom do? She notified Child Protective Services, as she should. Why? Because her child came home with all these bruises. Even though the child was received that way, nobody noted it. Nobody made a note of it. Nobody noticed it. Nobody had a conversation about it. And of course, in doing our evaluations, when the bus driver was questioned and when the school teacher was questioned about it, first thing that they say, yeah, we noticed it, but we didn't think anything of it. Wrong answer. Anytime you notice excessive bruises on a child and you have suspicion about it, it is your obligation to notify your program manager and, more importantly, to file a Child Protective Service report. Now, of course, you get more information from that on your onboarding by Human Resources, but it is your responsibility. If you notice it or if you see something, then you are responsible to say something. Well, at the end of the day, and of course it took several days, but at the end of the situation, come to find out that the bruises actually happened at home, and our bus drivers and our teaching staff was let off the case. But nevertheless, they still had to go through being questioned and administrative leave and so on and so forth. And that's the situation that you don't want to be involved in if you don't have to be involved in. Okay, so make sure you're doing these assessments on these kids when they're released to you. All right, so we talked a little bit about lice. Yes, they are excluded when they're dealing with lice for 2 days, of course. 2 days excused absence, although some parents do take longer than 2 days, but work with those parents to get that situation taken care of immediately. Okay. Sometimes children have croup. That's an excludable virus as well. Okay. They do need a doctor's note to return to school. Sometimes they may or they may not run a fever associated with this croup. Sometimes, again, not always, but sometimes they do. So, again, making sure that you're working with your parents when dealing with these communicable diseases to get these child back in school as soon as possible. Okay. Next slide, please. Okay. We also have pertussis. That is definitely an excludable virus. It's very contagious. Kids may be out anywhere from 7 to 10 days, maybe even up to 21 days. They're often started on antibiotics, and they will need a note to return to school. Okay. And we already talked about the croup. Okay. Next slide, please. Okay. Let's talk about ringworm and RSV. RSV, the child is excluded from school if he or she is running a fever, because sometimes they do run that low-grade fever and they have a continuous cough. And in those situations, the child does need to be at home with their parent, but they can return to school when they're feeling better and they're able to participate in activities. And they will need a note to return with RSV. Okay. And again, RSV is diagnosed by their primary care physician or, of course, a nurse practitioner. Ringworm, they can attend school with ringworm as long as it's covered up. But if it's in a spot where it cannot be covered up, then that child will have to stay home until treatment starts. And then they can return to school. And then oftentimes, parents typically just call their pharmacist and they get an over-the-counter antifungal cream, which is totally acceptable. They can definitely do that. But again, the important thing when dealing with ringworm that it has to be covered up. Okay. And they also need to consult with their primary care physician as well. Okay, next slide, please. Rotavirus, we talked about rotavirus. Looks like I got 2 of those slides in here about rotavirus. No, I didn't. I didn't talk about rotavirus. That was RSV. Okay, so rotavirus is another one of those contagious diseases that they will be excluded from school with, because it's typically these kids have so many diarrhea stools that their stomach is just so tore up that you can't even keep up with it. And they can return once the diarrhea subsides. Anywhere, it's usually, it can last up to 8 days, but typically anywhere 3 to 5 days is usual for an infant with rotavirus. And particularly usually just see this at the 0 to 12 months, sometimes up to 24 months. Okay, so again, lots of hand washing with this infection. Lots of hand washing with this virus. Scabies definitely excluded until they're on treatment, and they have to have a note to return. They're typically out 3 to 7 days as well. So these are communicable diseases, conditions, or viruses that a child is excluded from school during that initial time frame until either antibiotics have been started or treatment has been started. And then, of course, the symptoms themselves subside, and then they'll need a note to return. Okay, next slide, please. Chickenpox, definitely. Chickenpox excludable, come back once the chickenpox have scabbed over, and then there is no fever. 6th disease, same thing. That's a virus. Typically, these kids are febrile. Sometimes they are even hospitalized. I've seen children hospitalized because of roseola. But these kids feel bad. They look like their cheeks look like somebody slapped them in the face because they're so red. They don't have an appetite. They just feel blah. So these kids definitely need a note to return to school as well. And you can read everything about these viruses as it's in your handout, so I'm not going to take the time to read through everything. Strep throat, same thing, at least 24 hours of antibiotics before they can return. Sometimes parents do keep their children home 2 days, 3 days with strep throat. When you start getting in 3, 4, 5 days with strep throat, they will need a note to return. The important thing with these kids is getting them started on antibiotics as soon as possible. And oftentimes these kiddos run a fever. So they may be out 3 to 5 days, depending upon how their body reacts to the strep itself and to the antibiotics. Hand, foot, and mouth, you'll see that a lot in the spring, fall area. Highly contagious, especially on children who are drooling. They run a fever. They have little bumps around their mouth or in their hands, the palm of their hands, the soles of their feet. Sometimes they even have it in their private areas. So they definitely will be excluded from school as long as they're having a fever, and until, if they're one of those infants where they're constantly drooling, until the drooling subsides and or the pus bumps crust over as well. Next slide, please. Measles, definitely will be excluded from school with the measles. And another thing with measles to keep in mind is the fact that if we have children who parents have refused to get them immunized, in the event that there is a measles outbreak, those individuals will not be able to attend school either. Okay, so just keep that in mind. Okay, next slide. All right, bed bugs. Unfortunately, we don't exclude individuals with bed bugs, but we do recommend that if you find a bed bug on a child, that you use like a piece of tape or something to get it off the child. Of course, putting your gloves on. Stick it inside a Ziploc bag so that we can show the parents the bug, the actual bug that we pulled off the child. It's a touchy situation, so when you're talking to these parents about this, be as gentle as possible, and then make sure you let them know that you're not stating that they're dirty or they're nasty or anything like that. You're only stating the fact that we found a bug on a child, period. That's it. And then you can also ask in a nonchalantly way, make sure you check your home. If you don't have any resources, reach out to the health department, because sometimes they do have resources that they can utilize to help families with bed bugs. Okay, next slide, please. Diabetes. Yes, we do have children with diabetes. And because this is a complicated, or can be a complicated condition, we work with the staff one-on-one when they have a child in their classroom with diabetes. This is just some signs and symptoms to watch for when you're dealing with a child that is exhibiting signs of hyperglycemia as well as hypoglycemia. But again, because the teaching is so involved, it's something that we'll sit down to do one-on-one training with the staff members involved. Okay, so that is all for our session on communicable diseases, and I'll see you in our next session. Thank you for your time. Okay, in that section on communicable diseases, and then we'll start our next session here. All right, welcome to your next session on facilities and safety. My name is Nurse Yolanda. Glad you could take time out to meet with me again, and we'll jump right in. Oops, I'm sorry. Disregard all of that. Disregard everything. Okay, welcome back to our next session. Oops, sorry. I'm going to give you a pause here. That way you don't have to cut so close. Pause, pause, pause. Okay, welcome back to our next session on facilities and safety. It's a little short section. I just want to remind you to make sure that you are doing your facilities checklist two times a day for Head Start and 3 times a day for Early Head Start. It is your responsibility to make sure that we are providing a safe environment for our children. Make sure that you are staying in ratio with our children to caregivers. Make sure all the equipment works properly. There's no broken pieces in the classroom. Making sure all the medication is properly labeled, locked and up out of reach of children. Make sure that when the children are eating, they're eating at the designated in the designated areas for eating. Making sure that when you're changing diapers, that you're doing it in the appropriate area. So those are some of the things you want to make sure. If you have breast milk, that it's being properly stored, and making sure the refrigerator is being kept at the appropriate temperature. So those are some of the things that you will be doing on a daily basis, 2 to 3 times a day. Again, making sure that the equipment is working properly for our kids and providing that safe place for our children. Next slide. This is the hat that I talked about in one of our earlier sessions, the health assessment tool, where we actually come out and check your classroom to make sure it is safe for the child, making sure that you have extra gloves in the classroom, make sure that your first aid bags are properly stocked, making sure that you have your emergency contacts in your first aid bags, up-to-date contact sheets for every child, making sure that your flashlights are there and that you have batteries in them and that they are working properly. Again, double checking to make sure that that medication is locked and stored and up out of reach of children. Making sure everybody's been trained on CPR and first aid and universal precautions. Make sure that all of your personal equipment, your personal belongings, your purse, your coat, so on and so forth, is in a locked area, okay? So that no one can get into that information. Making sure that you're up to date on your TB and your TDAP. These are some of the things that we look for when we come out and do your hat. We also make sure that your team assignments is posted in the appropriate place and that all your posters is posted in the appropriate place. In one of the slides to come, we'll show you what that looks like. Okay. Again, I can't reiterate it enough. making sure that you have that medication locked and up out of reach from all children, making sure that that water is easily accessible and ready, available to children at all times. You're wearing your first aid kits every time you go out of the room with a child, making sure you do your daily and weekly checklist, and then making sure your posters are posted in the appropriate place. Okay, so those are the things that we look for when we come out. And we talked about those safety caps, making sure that the electrical outlets are covered with those safety caps. All right, make sure you have your emergency contact information posted by your landline. Okay, all landlines have to have emergency contacts, and this is what needs to be on there. You need your director, your program manager, family and community specialist, your program manager. You need all their phone numbers. You need 911, the ambulance, the non-emergency phone number, poison control. So this form is pretty much self-explanatory. Please read it over and make sure you have that information posted by your landline. If you are in Elkhart, you want the nearest Elkhart hospital. If you are in St. Joe County, you want the nearest St. Joe County hospital, okay? So keep that in mind as you are putting your emergency contacts list together. Next slide, please. All right, again, this is emergency contact list that you want to have. This is your poster board. This is the information that needs to be posted on your poster board. So you have your hand wash, and we'll give you a list of those posters. You may not be able to read all of them from this slide, but we do give you a list of all the posters that you need to post in your room. And this is what this is. Some staff members like to post the posters in order or according to the list that you're given. They just post it in that order, which makes it a lot easier for us when we come into your room to do your hat or your assessment. Also remember that in the kitchen, your kitchen posters goes in the kitchen. It should not be a diaper changing poster posted in your kitchen. In your kitchen is your 3 envelopes, your food restriction, your health conditions form, and your rejected medication forms, okay? Rejected medications is medications that have been brought to school and we do not have the proper paperwork to administer that medication. There's envelopes inside of here. You would take it out of here, you stick it inside of an envelope, and then you would lock it in a locked area that is rejected. In other words, we don't have the proper documentation to give that medication, okay? And again, I'm just going to reiterate that emergency contact list. You need your director. You need the person that's in charge in your building, because maybe you're in a building that has a principal. Their name and number needs to be on that emergency contact list. Your site manager needs to be on there. Your family and community specialist name and number. Again, the non-emergency as well as 911. The ambulance, poison control needs to be on there. Child Protective Services, the 1-800 numbers, all of them are listed in your handouts. The child care hotline information number, my number, and then you should also have my co-partner DNL's number, okay? So those numbers need to be intact and easily available. And then you also need emergency contact sheets of all your students placed by the landline as well, okay? So we're going to take a pause here and move on to our next section. All right, now we have reached the section of reports and letters. These are just some basic reports that would be beneficial for you to run. We'll start with the 4015, which is the Family Participant Report or the FLAGS report. This is basically Child Plus in a nutshell. It tells you if the child has a red bag or a healthcare plan or a medical need or missing immunizations or needs a physical. You will find all that information on your 4015. It will let you know whether or not the child is cleared to start or not cleared to start. Maybe they're not cleared to start because we don't have immunizations. Maybe they're not cleared to start because they have seizures and then we don't have a healthcare plan in place. It'll let you know if the child has a med bag, the red med bags that we talked about. We'll let you know also if the child has a healthcare plan, food allergies, any missing medical information, and pending medical appointments. Let me go back and readdress the med bag because I'm not for sure if I stated this earlier, but I'm going to reiterate it right here in the event that I did not. Anytime a child has a red bag, a copy of the health care plan, a copy of the medication administration form, a copy of the permission to administer medication form is placed inside that red bag along with the medication. That red bag will be given from adult to adult. So when the bus driver goes to pick up that child, that mother will give that red bag to the bus driver. It will never go in the child's bag. It will never be given to the child to give to the bus driver. The parent will give that red bag to the bus driver. The bus driver will in turn give that bag to the teaching staff when he takes the kids to school. The teacher will accept the med bag from the child and sign off on it. And then on the way back home, the same routine will apply. The staff teacher will give it to the bus driver. The bus driver will give the med bag to the parent. Under no circumstances will that med bag ever be in the hands of the child or placed in the child's backpack, okay? Without that red bag, the child will not be able to attend school because the child's medication is in that bag. If something happens, let's say the red bag is misplaced, they can't find it, whatever, let us know so that we can get another one for you. Okay? Next slide, please. Next, we have a 3065, which is the health event status. This report is good for family and community specialists when you're doing your follow-up medical and dental. Anytime a child has an identified need, anytime there is a failed screening, and it shows all that information and the case notes or the follow-up that you did. As long as you enter it into Child Plus, it will print that information on this 3065 report. Okay, next slide, please. Here's just some sample of some letters that we send out to the families. This one is a hemoglobin. Whenever we do a hemoglobin letter, we'll send that information home. Either we'll give it to the fax to give to put in the child's bag, or the or to the parent, or we will also send a copy home to the parent. So this information goes home with the child regarding that hemoglobin level. The letter in the middle is if you're missing, and this is really for the family and community specialist, if you're missing any medical information of physical, lead, hemoglobin, well child form, you use this to communicate with the family members that you're missing that medical information, and there's also one that goes directly to the doctor's office. Okay, so that's a way of communication. Once you send that information, send a letter of that information home, place a copy in the file, and then also you can also scan a copy in Child Plus as an extra layer of communication because we'll know what letter was sent home. Okay, next slide, please. Also, our 3015s and our 3016, we use those a lot at the beginning of the program. Oh, let me go back to the 4015. Can you take me back to the 4015, please? Thank you. 4015, ideally at the beginning of the school year, you should print these daily because we get bombarded with so much information that we are updating and changing these on a daily basis for like the first 30 days. Then after that, you can run them weekly. All right, I'm sorry, you can go back to the 3015 now. 3015 is the report that Head Start utilizes, and 3016 is the report that Early Head Start utilizes. It is the missing medical or health screening report. It tells us whether or not the child is missing a physical, dental, lead, hemoglobin, blood pressure, hearing, and or vision screenings, okay? So all those screenings are notated on here. This is what the 3015 looks like for Head Start, and this is what the 3016 looks like for Early Head Start. Again, these is one you would like to print on a daily basis for the first 30 days because we are so busy with receiving information from parents, from staff members, from doctors' offices, that it changes so quickly. And then after that, you want to print it every weekly and then every 2 weeks, depending upon where you're at in obtaining that information from the parents. Okay? Next slide, please. Okay, let's talk about these fabulous incident reports. Anytime a child gets injured or a staff member gets injured, you are going to fill out an incident report, and you are going to fill it out in its entirety. All right? Incident reports are communication. It is communication between staff and parents or staff and staff. Fill it out in its entirety. Your program manager must be informed of all injuries that take place on the property. Okay, so keep them informed. For all major incidents, let's say a child breaks a hip or fractures, those are filled out in its entirety and given to your program manager and emailed to us immediately. There's no hesitations, there's no delays. This is done immediately. Why? Because we need to get this taken care of as soon as possible and get this child with the proper care he or she needs. So get that to us as soon as possible. Major incidents, again, you get that information. Major incidents, remember, you get that filled out as soon as possible and get it filled out and get it sent to us as soon as possible. And we make sure that Dr. Kathy gets a copy of that. All incident reports goes to the incident email address. Okay, all incidents goes to the email incident accident email address. Okay, but your emergency ones, you're sending them directly to your program manager and directly to us so that we can sign off on them. You only send those your incident reports after you get your signature of your program manager. Okay, staff, if you get injury, please report the injury the day of the injury, the same day. Don't wait till the next day, okay? And a copy that must go to Human Resources, again, after your program manager signs off. There's more information that's going to come on the incident reports as we are actually making some changes to them. So you will get more information from Human Resources regarding your incident reports as we get closer. And also, as I spoken earlier, your team assignment sheets, they may change as well. But again, we'll keep you updated. And then lastly, there are some other safety policies and procedures that we're currently working on that will be tweaked a little bit as well. But again, once all those policies and procedures get updated and tweaked, you will get a copy. Right now, the copies you have are the old copies. Continue to utilize them, and then as we update them and tweak them, you will get a new copy. But again, incident reports, again, fill it out in its entirety. And then anytime a child has a head injury, I don't care how minor it is, I don't care if somebody hit him in the head with a little toy block, or you're going to call that parent, you're going to notify that parent, you are going to tell them to watch their child for any signs of head injury, including but not limited nausea, vomiting, or change in level of consciousness, and you are going to tell them to follow up with their doctor as needed. Why? Because we don't ever want a head injury to go unnoticed. I don't care how minor it is. There has been incidents that I've read about where a child had gotten hit in the head at school, not our school, but in different states. But the child was hit in the head. The information was not communicated to the parents. The child went home, went to sleep, and the child was hard to wake up, and the parents had to rush the child to the emergency room, and the child was unconscious due to a brain bleed. So again, all head injuries, I don't care how minor, please call that parent, notify them, let them know what happened. Fill out that incident report, have your program manager fill it out, send it to the incident email address, and then you're also sending them to us monthly at the end of the month report, and then you're also, no, scratch that, do not send them at the end of the month report. Get them to us as soon as they happen. Send them to the HS accident incident email address. I'm so sorry. I got tongue-tied to those. Okay, so don't send them at the end of the month. You want to get those done and sent as soon as possible. Okay? All righty. We are going to take a pause here, and then we'll start our next session. Okay, now let's talk about diaper changing. Welcome back. I am Nurse Yolanda, and scratch that. Okay, welcome back. Let's go into our diaper changing. Okay, this is diaper changing for early Head Start and 3-year-olds. All right, so diaper changing. You must have a designated area. Okay, you must have a designated cot, and it is not a cot that the child will be sleeping on. It is a designated cot specifically utilized to change diapers, okay? And then after diaper changing, you will sanitize it just like you do your diaper changing table, okay? So when using a cot, remember it must be labeled for diaper use only. Diapering space should not, I'll say it again, diaper spacing should not be located in the kitchen area. You're going to wash hands before and after diaper changing of the child and the staff member. You are going to remember to keep one hand on the child at all time, and you're going to be doing engaging activities, all right? You are going to clean and disinfect that area according to the policies and procedures that you are to utilize from the CACFP coordinator, okay, which most sites is the Purell. All right, so you will use that protocol. Remember, you're going to record the child's diaper change and any unusual observations such as rashings or bleeding on the daily record sheet, and you're going to give that sheet to the parents. All right, pretty simple, right? So keep that in mind. Also, there are specific instructions for diaper changing for our babies. And I won't go over them one by one on this slide, only because it's lengthy, but you do have a copy of it in your manual. Please, please read the diaper changing for early Head Start and for 3-year-olds, okay? Read them, practice them, go over them, and know them, okay? All righty, and I've also included some different videos on diaper changing that you can utilize, so you will have a copy of this information. And that's it for this segment. So we'll take a quick pause here, and then we'll move to our last section. Okay, welcome back. I know there's nothing here but a thank you and a memory game, which you won't be able to participate in because you're doing this at your leisure. But nevertheless, let's talk a little bit about COVID. As we know, for the last two to 3 years, we have been through a lot of different changes with COVID. And so all of our COVID guidelines right now is currently coming from the CDC and our local health department. As of right now, there are no shutdowns, classroom closures if anyone tests positive for COVID. So right now, the current guidelines are if the individual tests positive for COVID, that individual must quarantine at home for 5 days. He or she then can return to work wearing a well-fitted mask for the next 5 days. Okay, so it's going to be a total of 10 days that individual will wear his or her mask. 5 days at home, and then 5 days when they return to school. Also keep in mind that if a teaching staff or a student tests positive for COVID in the classroom, make sure you notify the health team. We will get a letter to those parents so that they will know that their child was exposed to COVID-19. But as of right now, those are the guidelines. Will they change? I'm not sure. They may or they may not change. But right now, there are no more closures, closing down the classroom for COVID this or COVID that. If you test positive, you quarantine at home for 5 days, and then you can return to work wearing your mask for the next 5 days. Okay, so that's all we have for our COVID guidelines. Well, that's the end of that section. Okay, welcome back. Let's just talk real quick about our safe sleep and what a safe sleep environment looks like. Although you will get this on iLead, I do want to touch a little bit on it so that you will know what it comprises of. Creating a safe sleep environment for our infants is when we're placing them in the crib. Remember that we're going to place them on their back, so back to sleep. We're going to place them on a firm mattress, okay? And the only thing that's going to be in that mattress is the baby. You're going to have a fitted sheet to cover the mattress. There will be no blankets, no pillows, no sheepskins, no bumper pads in the crib with the baby. There will be no soft objects such as toys or loose bedding in the bed with the baby. None of that will be in the bed with the baby. We're going to make sure that the baby is on that firm mattress. And basically that's about it. Some babies do have special circumstances where the head of the bed may have to be elevated because of a condition. In those circumstances, we do have to have doctor's notes to support the reason we're doing what we're doing if it's out of the norm. But again, those are very rare circumstances, but we have had it in the past with one child who had to have a pillow crib. And a pillow crib is those slanted pillows that go in the crib to elevate the head of the bed because of the condition that child had. But other than that, nothing goes in the crib with that baby but that baby, and it goes on his or her back to sleep. Okay, I think that's all for me. If you have any questions, again, please don't hesitate to reach out. I can be reached at 574-849-1859. And again, thank you for your time and welcome to Head Start.